Now this picture will show you the relationship between the epithelium and connective tissue. You can see this is ultramicroscopic picture. This consists of retipex, epithelial retipex extending into the connective tissue. And the connective tissue has projections into the epithelium, this part. This is the, this anatomic feature gives orange peel appearance to the keratinized mucosa. Again, this picture of the picture of gingival tissues repeated. I have already said, described that oral epithelium is keratinized and circular epithelium is non-keratinized. Circular epithelium is semi-permeable, which allows two-way exchange of chemicals, biochemicals, means the bacterial or toxins can penetrate the junctional epithelium or circular epithelium, and biochemicals from the body which are protective, they can, or inflammatory cells, they can infiltrate into the gingival surface. Now there is a small description regarding oral and circular epithelium. Gingival or oral epithelium is keratinized. Sulcular epithelium is non-keratinized generally, but if a person is maintaining very good oral hygiene, the most coronal part of circular epithelium can also be keratinized. Now circular epithelium is semi-permeable, which allows two-way exchange of chemicals. Which chemicals? Bacterial toxins and then biochemicals from the defense cells. Generally you will find a discrete band of inflammatory cells. Always it is always present in this part of gingiva.
باختصار النفاذية بالعربي النفاذية اللي هي تعني اللي هي قدرة المواد على الانتقال من مكان لآخر، يعني زي الشيء المسامي الذي ينتقل من مكان لمكان آخر، هذه النفاذية permeability.
Now dentogingival junction, I have shown you already some pictures. I think you can recollect in your mind. I will just describe a little bit from the slide itself. Dentogingival junction, it has two parts. One part is tooth surface, the other part is gingiva. They contact each other. One part is, of course, soft tissue also has two parts: junctional epithelium and gingival fiber apparatus. Gingival fiber apparatus is very important for attachment of gingiva to the tooth surface. Now this picture shows the dentogingival junction. This is junctional epithelium. It is generally only 1 to 2 cell thick in the apical part and can be 15 to 20 cell thick in the coronal part. It is attached with the help of same type of attachment, which is between the connective tissue and epithelium. What do you call it as the attachment between connective tissue and epithelium? It is this connective tissue is attached to epithelium is attached to both sides with the help of basement membrane. Of course, on the connective tissue side also there is a basement membrane. On the tooth side also it is basement membrane. And basement membrane has two parts in the dentogingival junction. One is lamina densa, which is on the tooth side, lamina lucida, which is on the epithelial side. This I think I have already explained. Now this is another picture showing regarding the anatomy of the gingiva and the teeth. I think I need not to repeat regarding this.
Yeah.
Now gingival connective tissue, which is an important part of dentogingival unit. This is also known as lamina propria. What are the components of lamina propria? This is epithelial tissue. This is attached to the connective tissue with the help of basement membrane. Now they consist of fibroblasts. Of course, this is just a pictorial diagram. It is not actually a electron microscopic picture to make it look easy, which consists of fibroblasts, which are abundant in connective tissue of any part of the body. It consists of macrophages, inflammatory cells, capillaries, and extracellular matrix. Extracellular matrix consists mainly of collagen fibers and proteoglycans and glycoproteins. Proteoglycans have defensive role. It helps in immune system, and glycoproteins help in attachment of different cells with each other. Now The other part of dentogingival unit is very important. These are gingival fibers.
Fibers.
Gingival fibers are many groups. This is circular fibers. I will show you a cross section also. This is a dentogingival group of fibers. This is alveogingival. This is periosteo or periosteogingival. This I will show you in a cross section along with a longitudinal section. These are, they have shown dentogingival. This is interpapillary. This is cementum of the tooth. This is transgingival. They attach from gingiva of, they are transgingival from cementum one tooth, and they attach to the cementum of the adjacent tooth. This is transgingival fibers. This is circular fibers.
But not to the second teeth, to the
Yes,
next one.
yes, another tooth. I said adjacent tooth.
Uh-huh.
Again, sorry if you are not able to, it is not clear to you. This is transgingival group of fibers. They will originate or attach between the cementum of two adjacent teeth.
Yes, sir.
Okay? No problem. If you are not able to understand, you can in between tell me, and then I can clarify.
No, I just
Yes. I think this, if you go through this picture 2-3 times, all the group of gingival fibers will be easier to understand.
So I understand, but I just ask you to review for.
Yes, I know. I'm not telling you now. I'm not telling you. It is for the audience which will see this video. It's not for you. What I am addressing you as a student now, not as manager of the IT. Okay, to make it lively so that there is somebody to discuss.
Right.
Like it doesn't look like that. It is solo event. Solo you means single.
One, yes, solo. Even music. Solo,
yes.
It's in one.
Yes, solo music. Yes. This is another very good picture which shows a group of different group of dentogingival fibers from the crest alveogingival group. This is dentogingival group, and this is circular group. This is another picture with how the different groups of fibers, they are intermingled with each other. Make a network. We come to the next part. What are the normal clinical features of gingiva? Now, as written in your book, Karenza, they write that it is coral pink. But coral pink is not seen in Asian population. It is seen in mainly Caucasian.
I will ask you for something.
Yes.
Make it like introduce for this part. Okay. I will ask you something. Make it as introduced to this part. Doctor, how can we differentiate between normal gingiva and abnormal gingiva?
No, I will take up that. In the subsequent part, I will show you the pictures of abnormal gingiva, different color changes, and changes in the architecture, everything I will show.
Okay. That's one. Okay. So, what's the clinical features of the gingiva? Clinical features of the gingiva?
Clinical features, color, consistency. I will cover all this.
I will ask you.
Okay. Yes. No, I am not telling you. I am telling the audience also that I am going to cover all normal clinical features of gingiva in detail. First is like color, contour, consistency, surface texture, and the position of gingiva on the tooth surface. I will discuss all now here, one by one. First is color. Color coral pink, as written in the book, it is not seen in Asian population. Generally, Asian population you will see color as you see at the right corner of the downside corner of the slide. This is generally you will see in pinkish color with slight grayish discoloration. But this coral pink only seen in Caucasian race. This color, if you want to see, you can see in Maybelline or Oriflame catalog.
اللي هو القوقازيين يعني.
This is another picture of normal gingiva. It shows some clinical features very nicely. You can see this is the contour of gingiva. This is normal contour. This is scalloped. I will show you what is the meaning of scallop in subsequent slide. Actually, it is a garlanding. I will show you. I have inserted a picture of that. This is the surface of attached gingiva. See these shiny dots. This is rough surface of keratinized mucosa. It looks like orange peel appearance. Color of gingiva. What decides the color of gingiva? It is dependent on degree of keratinization and blood supply. Of course, racial pigmentation known as melanin also gives color to gingiva. It can vary from individual to individual.
Maybe in the African people, they too many melanin, so it become more dark, I think.
Yes, no, it varies from person to person.
Yeah.
Even the degree of melanin pigmentation will vary from person to person.
But more common in the black Europe, I think, right? So,
Yes, it is common even among the Asians. You will find a lot of people having. I have seen people with fair skin with the melanin pigmentation in gingiva. Now, size of gingiva. Size of gingiva depends on what are the components of gingiva, like connective tissue and epithelium, and the underlying alveolar bone. Like in this slide, you can see this is thin biotype. This is very thin tissue, and this is thick biotype. In this type, this is slightly thicker gingiva. You can see in the margins. This is slightly thick, but it is considered as normal. This is not nothing abnormal because this thickness can vary because of underlying bone, size of connective tissue, or the epithelial. Sometimes epithelial tissue can also be thick. Now, contour of gingiva I was describing in previous slide. It is considered festooning pattern. What is festooning? You hold any string or garland between two points and just hang it. The pattern which will be formed, it is like this. It is called as festooning. I think it may be clear. And this festooning pattern of gingiva depend on shape of the teeth, bone, and height of contact area. In this picture, it is showing that the festooning is very little. It is less festooning because first of all, maybe the teeth surfaces may be flat. This is first reason. The gingival margin can become straight line. Another thing is like if the contact area is very deep apically, then also interdental papilla can, of course that slide I forgot maybe, this gingiva can become shelf-like, it will become straight line. It's okay? Okay, now consistency. Consistency of gingiva is firm and resilient, and it is tightly bound to the underlying bone, but the consistency of gingiva depends on the amount of collagen present. Of course, if there are any bony prominences, the gingiva will appear to be hard. Surface texture, it is stippled, or it is orange peel appearance. As you see, this is orange peel, this is surface texture of normal gingiva. How it is formed? This is formed by extensions of connective tissue into the epithelium. This is the electron microscopic picture of gingiva and connective tissue. You can see this connective tissue is extending into the epithelium tissue. This is the microscopic feature which provides orange peel appearance. This slide is not. Now you can see the epithelial red pecks. They extend into the connective tissue, but note the point. Normal junctional epithelium doesn't have retipex at all. Now, alveolar mucosa, epithelium is thin. In alveolar mucosa, it is non-keratinized. It is more vascular, and it consists of a lot of elastic fibers which give flexibility, and it is loosely attached to the bone. It is not attached to the bone as firmly as attached gingiva. If you want to check alveolar mucosa, you can check when you will stretch. You do a stretch test for lip up to where the muscles are attached. That is mucogingival junction. Apical to it is alveolar mucosa. Continuous with the labial mucosa or buccal mucosa. Now, periodontal ligament. It is a very important part of periodontium because they provide attachment of the tooth to the alveolar bone as well as the cementum of the tooth. Now, periodontal ligament, as you see, there are many groups. This is alveolar crest group. From here, this is oblique group, and this is actually there is horizontal group also in this. This one, this is oblique group, and this is apical group. Oblique group is the largest group of the periodontal ligament fibers. Functions how they perform their work. is like hammock. Hammock, you know hammock?
Hammock?
Yes. Hammock, I will show you picture. This is hammock. This takes the load of apical load of the occlusal, the oblique fibers function like hammock. This is the function. Now this is another picture showing different group of, yes. There is another group of fibers, periodontal ligament fibers, which are known as transeptal fibers. They extend from cementum of one tooth to the cementum of adjacent tooth, and interradicular fibers. And these are apical fibers. I think these pictures are clear.
Yes, clear.
Anything to be explained in this?
No, it's clear.
Okay. Now this is hammock. This actually depicts the function of oblique group of fibers. This is how it functions. Because if somebody will lie down, this will not break. This is how when you apply longitudinal force on the occlusal surface, it will take all load. Now functions of periodontal ligament is very important. Physically, the periodontal ligament fibers, of course, it is in the form of fibers, physically suspend and attach the tooth surface in the socket, protect the tooth from the bone from shock due to occlusal forces because of its viscoelastic fluid present in the gingival fluid in the periodontal ligament space. I think somewhere they have shown, because the periodontal ligament fibers have wavy pattern. Regeneration, because periodontal ligament they have non-differentiated mesenchymal cells. In the event of healing or healing, they can be differentiated into osteoblasts, cementoblasts, and fibroblasts. The nutrition is one of the other function of periodontal ligaments. They remove waste products and supply the nutrients also via blood vessels and lymph. And there are certain receptors present in the periodontal ligament fibers or periodontal ligament tissue. There are certain receptors which are which transmit pain sensation and tactile sensation. It is very important. This is the difference between implant and natural tooth. Implant is directly attached to the bone. There is no periodontal ligament, so those type of receptors are lacking. So sometimes you can give some extra force also on implants. This is the main advantages of having a natural tooth.
Yeah.
Now width of periodontal ligament or periodontal ligament space, it is one and same thing. It varies from 0.25 plus minus 0.1 mm. This is hourglass figure. Why this is fulcrum, center of fulcrum is generally in the middle of the root, and when there are lateral forces, they make the tooth a little bit shaky. Of course, normal tooth also has some form of mobility within physiological limits. So this is how it will look like. This is called as hourglass shape.
So blue
yes,
specs for the physiological.
Yes, physiological space. This is hourglass shape. Okay. This is narrow in the middle and slightly wider at the apex and coronal part. Now cementum. I think periodontal ligament is okay. Good. Cementum. Cementum is calcified connective tissue. It is actually a connective tissue which covers the anatomic root. It is made of calcified matrix and collagen fibers. Structure of cementum is similar to bone. I am not going to details of it because it is formed by cementoblasts, and then they are surrounded by matrix which is calcified in the form of, then they survive in the form of cementocytes. The inorganic content of cementum is 45 to 50%. It is permeable and susceptible to toxins and bacteria. This is physical characteristics. It is light yellow in color, even lighter than dentine. Thickness acellular cementum. It is the coronal part. It is 25 to 50 micron. Cellular cementum 150 to 200 micron. Permeability, it is permeable to from both